depending on what they come in for. If it's like really chronic illnesses, this could be like autoimmune, mystery infections, even cancer. We could do the neural therapy as a starting point just to reset the nervous system. Because once the nervous system is reset, the innervation to the organs is more beneficial. Like it's more effective for anything else you're going to do, whether you're giving IV vitamins or oral supplementation. If the nervous system is balanced, it can intake the nutrients better and expend energy more efficiently. The treatments for the neural therapy improve detoxification function because you're just restoring the nerve flow to those organs that are supposed to help you detox, like your liver and your kidneys and your colon. So you're just kind of restoring order back to the way the body was meant to.
Welcome to the Pure Wellness Podcast, where we talk about what it takes to live a holistic lifestyle by making conscious, healthier choices. Our hope is that these discussions will inspire you to strengthen your daily practice to improve overall physical, mental, emotional, and social well-being. Pure Wellness Podcast provides information solely for educational purposes and is not intended to be a substitute for professional medical advice, diagnosis, or treatment. I'm your host, Johanna Altman, founder of One Body Medicine, avid health enthusiast, and mother of 3. Join me and industry professionals as we explore human potential in the pursuit of pure wellness. Thank you so much for joining me and the Pure Wellness Podcast. Today, I have a very special guest, Dr. Clement Lee. Thank you so much for being here.
Thanks for having me.
And I'm very excited to be talking about a topic I'm not too familiar about, neural therapy. And doctor, for those that don't know you, would you mind telling me a little bit about yourself?
Sure. I'm Dr. Clement Lee. I'm a naturopathic doctor, founder of Optimal Health and Wellness in Pasadena, focused on regenerative medicine, anti-aging, chronic illness, and just general wellness. So we focus on getting people just back to their optimal selves, however possible. But we're bringing in neural therapy as a topic today, amongst other things that we do. But This is a very, very, I would say, profound treatment that's worth exploring here.
Absolutely. As I had mentioned earlier, I knew nothing about this, and I have a lot of questions. So first question being, what is neural therapy and how long has it been around?
Sure. Neural therapy is an injection technique typically involving Procain and other anesthesias, so other local anesthesias. But the treatment itself has been around for over 100 years, like originally early 1900s is when Procaine was actually discovered, and then the use therapeutically was used as a local anesthesia. But it was discovered that it can actually cure multiple situations just by locally injecting it in to the vein, as well as into direct nerve or interference fields as a terminology in neurotherapy. So you're basically restoring order in the electrical systems of the body with the use of neurotherapy.
Okay, so that was a lot to unpack.
Sure.
So I'm going to ask you a few more questions pertaining to that.
Sure.
So let's go back and talk about the body's autonomic nervous system, which is what's responsible for the automatic functions of the body, the heartbeat, the breathing, things like that. So what is that? And why is it important?
Okay. The autonomic nervous system is the part of the body that controls your organs passively without you actively thinking about it, but it regulates anywhere from your blood pressure to your temperature to your vasodilation and just the survival functions of the body as well too. But it's broken apart into we call it sympathetic nervous system and the parasympathetic nervous system. So one is more of an excitatory pathway, one is more of a calming regulatory pathway. And when they're running in a perfect order, we typically have homeostasis. The body can go through different stressors and come back down to normal. When they're disorganized, when there's too much signaling from either side or a lack of signaling on either sides, then that's when the body can run into issues here. So the sympathetic, we consider like the fight or flight response, and also including freeze. So the body can actually just kind of literally freeze in place. But also the parasympathetic nervous system is responsible for the calming, rest, digest, sleep part of the nervous system as well too. So they're very, very important to make sure that they're running the way they're meant to be.
Of course. And one of the things we were talking about before is how the autonomic nervous system is not really something that's talked about that I hear
Sure.
when people are describing symptoms or conditions where they might need to go to a doctor for treatment.
Yeah.
Right? So this is all very new to me, very interesting. And one question I had is, what would cause a disturbance or an interference or a lack of homeostasis?
So it could be multiple things, but just starting from more of the superficial level, like a cut, a scrape, a topical injury, a contusion, a bruise. So that disrupts the tissue integrity and also the nerve flow into that area, sometimes temporarily. And sometimes if you have a cut, the scar is lingering there. But that can block the flow of electricity through that area, the way it heals. So in some cases, it may actually change the voltage in that region where it is. And so that could actually affect the way that the innervation running through that area is working, as well as from a more Chinese medicine standpoint, is just the flow of qi throughout that region.
So qi, is that going to be, yes, that's the flow of energy. How is that similar or different from the electromagnetic field that we know runs throughout our body?
It's a little bit different. Yeah.
Okay, so what is the difference?
So the electrical signals are actually like you can measure with an actual electrode.
Okay.
And you can put the electrode stickers and see the flow of electricity through the area. Qi is more of like a light-based pathway. So there's like microtubules in these channels throughout our fascia that you can actually, nowadays with new technology, you can actually visualize like a person's visual field and light patterns through the system.
Oh, wow.
It's really neat stuff. Yeah. Wow. So this is why like the neurotherapy goes beyond just treating like scars and we're just going off topic, but really like it's very helpful to understand like there's the pathway of energy and light versus the electrical chemical pathways, which is mostly primary neurotherapy to start with. Yeah.
Yes. So when we're maybe injuring ourselves with a bruise or we keloid or like in my instance, we had talked about, I had 2 C-sections with my children, and it never occurred to me until I started doing research on this topic that the C-section scar I had might be something disturbing my autonomic nervous system, because I don't really have that I can think of symptoms, chronic symptoms. I'm not having headaches. I'm not having chronic pain. So how would that disturbance, if it's not manifesting in a noticeable symptom, how would I know that this is a treatment or therapy that could help me?
From a cosmetic standpoint, this is where it's also beneficial as well too. I mean, but structurally, when a scar forms in place, think of it from more of a fascial plane. Is the fibers line up and they may not be in perfect order.
Yeah.
And then so it's like a saran wrap that's just stuck together.
Yeah.
So there's adhesions in that space as well. So the neurotherapy can be used as a way to actually disturb those adhesions so that on a structural standpoint, it actually smooths out. So it actually can feel better for the individual as well too. But for going back into like the neurotherapy aspect of it, whenever there's a scar, there's a change in the voltage that is feeding into that area. So this can basically be a energy loss point.
Okay.
So the body can be sending a lot more electrical charge to, especially a keloid, which then is just draining your electrical energy throughout the system. So
it's not receiving that energy.
Well, the energy is being outputted by your body. So then as a person, you might just function a little less optimally as you should, because energy is being expended and unnecessarily within that scar.
Okay. And so for me, because I don't have symptoms, and I like to use myself as an example because I'm a typical patient, and I come in for the scar tissue that I have from my pregnancies, and I have this therapy done. Even though I'm not feeling any symptoms of headaches or chronic pain, would I possibly notice more energy or other measurable things that I can feel better after this therapy? Because again, I'm not having the chronic pain or the headaches. That might be something that I would notice. Yeah.
You may notice a little bit more energy, physicality. You might just have better sensation in that area. Sleep might improve a little bit. The thing is, it's the meridian that it's actually impairing is a very large meridian that runs through the central channel of the body. So that can be just like a roadblock of energy flowing down into the lower pelvis. So you may notice just more improvement in your, your reproductive organs, but it's hard to measure like just from that alone. The thing is, some of these symptoms may not manifest until like 5, 10, 20 years later down the road.
That's also
So
what I was going to ask.
Yeah. So this is why, if you have a scar, it's helpful to address it sooner than later because you're high functioning, your body is running reasonably well, but it is just a loss of energy at some point.
At some point, it might catch up because we're not as efficient.
Right.
Okay. So I'm a patient walking into your clinic.
Sure.
And I'm possibly dealing with chronic pain as my chief complaint. And you notice that I have, a scar maybe on my arm or lower back, whatever the site of pain is. How do you assess whether or not I'm a candidate for this therapy?
Well, if you have scars, that's obviously
that's number one.
Number one. Those are just disturbance in the energy field that then affects energy flow in the body. So a lot of pain usually comes when there's fatigue involved as well too.
Okay. Now, what if I don't have the scar? That's a tricky question.
Well, then we look into the history of the patient and figure out if there's also emotional traumas as well too.
Okay. So let's go into the emotional trauma aspect and how that can cause a disturbance or interference in the autonomic nervous system.
So when you have emotions, they actually elicit electrical charges to the different organs or actually through the autonomic nervous system. So when you get scared, your sympathetic nervous system fires and it's actually sending electrical impulse. If that threat, still perceives in the body as an ongoing threat, then you're just going to be constantly sending electrical chemical signals, probably endlessly until the body gets the signal that it doesn't need to anymore, which sometimes doesn't happen, very easily.
Oh, wow.
Yeah.
I didn't even think about that.
So you have emotional traumas. It can be grief. It can be sadness. It can be, the just extreme stresses in life. But those have elicited, functions to the nerves. And then the nerves may be actually injured. And they're in the sense that their electrical impulse is not balanced the way it was before.
That's very interesting because I know that book, The Body Keeps the Score.
Yeah.
It talks about how the emotions are held within the body and ultimately manifest themselves in the physical form as ailments, but not the process by which it does. And you're kind of explaining to us
it's getting to a point. Yeah. So there's the fascia itself can hold memories of the emotions as well too. This is where the body, like the different organs and local tissues can have. This is why treating certain scars, they can actually release the emotions that are trapped within as well too. So it gets very interesting. Yeah. So let's say, with a C-section scar, you had emotions at the time of the delivery.
Yes.
It could be good or bad, but it can release them from that tissue plane. And so some people who have traumatic scars, they actually release the emotions. They can cry immediately after there, but there's actually transformation in how they feel afterwards.
That's so
very interesting.
Wild.
Yeah.
That's so wild. And now that I'm learning more about neural therapy, what I'm thinking about is this a therapy that can be used in conjunction with other, for example, pain management therapies? We talked about PRP prior.
Yeah.
And how is that different? Like injecting PRP into a joint for chronic pain is obviously a different approach, but is that therapy used in conjunction with neural therapy more effective than one therapy alone?
Yes, I would say having the combination. So PRP, for those who are familiar with it or not, it's a localized injection meant to stimulate healing within that injured region. So the PRP has platelets that are activating growth factors that basically stimulate new tissue growth in that region. That is governed by blood flow, which is what PRP initially activates, and also by nerve flow. So if you have the blood flow, but the nerves are not firing optimally, you might run into an issue where you're not getting the best results from the PRP treatment. Wow. And so some of the nerve flow could be impaired by your autonomic stressors that might be going on, or local scars that might be interfering with the actual conductivity to that joint as well too. So this is where you can do, a variation of they call segmental neurotherapy, where you can inject just superficially over, an injured joint and then inject the PRP or stem cells or whatever injection directly into that joint.
Oh, wow.
Yeah. So you just get the most out of the potential healing in that joint space.
Okay. So as a patient coming in for this therapy, walk me through the actual appointment, what I can expect, how long the therapy is, how many injections am I possibly getting?
Okay.
So what does that look like?
So we usually have a consultation for maybe 30 minutes to an hour, depending on the complexity of the case. We go through the history of the patient and also different exacerbating factors. And then also I do recommend certain labs to be run to also help, look into the entire picture. But if it's more of a neurotherapy related appointment, we can talk about then the actual stressors, the emotional traumas, and any physical scarring that they may have as well too. So then it just gives me a kind of a roadmap of which to be addressing. If there's an emotional component, which most people, unfortunately, they do, we would work on the autonomic ganglia injections with neurotherapy, which is different from, slightly different from the initial neurotherapy, which is more the segmental or localized scar treatments. So these are actually deeper into like the vagus nerve or the stellate ganglia that control the autonomic nervous system.
Okay, so let's go more into the stellate ganglia and what that is and how that's related to the autonomic nervous system.
So the stellate ganglia is one of the major nerves that controls your sympathetic nervous system. So it actually innervates to the heart, but this is what like people would describe like a fight or flight response if that nerve is firing, endlessly. So people can be kind of stuck in that phase. People who go through just, high level of stress, they just get used to that. And so the nervous system actually is just constantly stuck in that mode. So the treatment for the stellate ganglia, and this is not unique to neurotherapy anymore. Like a lot of anesthesiologists are utilizing stellate ganglia blocks for people that are stuck in this fight or flight mode. So essentially, they would just inject a local anesthesia. It doesn't have to be Procain, but typically we use Procain, just lower side effect profile. But as it's injected into the stellate, it gives the stellate a chance to take a break, for the length of anesthesia, which then sends the signals to the brain that everything's all cool for now.
And that's a 15 to 20 minute.
Yeah. So the Procaine itself, the half-life is 20 minutes or so.
Okay.
So most people within 20 minutes, the effect of the medicine has probably worn off by then. But the end effects is letting the body actually feel relaxed for once in a long time.
Okay. And then do we go right back up to the fight or flight after that?
Not necessarily, yeah.
Okay, so what happens after that?
So we're talking about after the injections?
After the injection, we're feeling calm, relaxed.
Yeah. So the analogy I can give, which is easily to understand, is imagine your computer that's been on for a very, very long period of time.
Okay, that's me.
That's most people. Yeah, you just forget to press the restart button.
Yeah.
The injections with neurotherapy into the autonomic ganglia, so this is both for the parasympathetic and sympathetic nerves, is equivalent to resetting the computer.
Oh,
so it doesn't automatically close all the apps though. The apps are still there when the computer starts back up again, but the computer can run a little bit better once it's been reboot. So if you get a chance to eventually close those apps over time, you may need to reboot it less often. So that's kind of a better way to kind of see how you need. So if your apps are going to be continually on, you might need to do neurotherapy a little bit more frequently, to meet the demands that, you need
that
to keep functioning. Yeah.
So having said that, is this an immediate, something they feel immediately after the treatment, like that sense of calm?
Yeah. It's like a forced vacation, really. It's for your nerves. The effect of what happens is when we inject, especially into the autonomic ganglia, it's blocking the sensory inputs to the brain related to the stressors that are going on. So the brain actually just doesn't feel much. I mean, it doesn't knock you out, so you're not like passed out, but you just feel a sense of like calmness because you're not sensing any stressors going on in the body at the moment in time.
That's amazing.
Yeah. It's very interesting.
And are there any side effects from this therapy? Not
necessarily. I mean, the most is like you go to the dentist when they numb, a certain part of the face, you get fat and heavy for the 20-minute duration. There might be some soreness where, depending on where you inject it from the injection site, because you have to sometimes pass through muscle groups. You're getting a little bit of a trigger point injection. So usually if there is any soreness, it's for like the day of and maybe a little bit the day after.
How deep is the injection and is it painful?
There's a couple areas that are painful, a couple areas that actually pain less. The vagus nerve is probably one of the more painful ones because we're actually running through the sheath that covers the bundle of nerves to get to that point. So that one, I would warn patients that there is a bit of pain associated with that injection for like a couple seconds because we are injecting anesthesia. So after the anesthesia is flooding that area, the pain does go away. But certain areas like the stellate ganglia, you don't feel much because it's a very shallow injection, but we palpate to get to that point. So technically, if you just injected it without pushing the skin down, it wouldn't have to go rather deep, but we're just pushing it, the tissue in so that you don't have to go that deep. The vagus nerve is about an inch deep, inch and a half deep. So it's
I'm not doing that one.
I mean, it's each person's their own.
Babe, so why would you recommend doing the injection in the vagus nerve? We understand the ganglia.
All right. So the vagus nerve is the basically opposite of what the stellate ganglia does. So the stellate is more of your sympathetic, your fight or flight, and the vagus is more of your rest and digest and repair and regenerate side of the nervous system. So when the body goes through various stressors, sometimes the vagus nerve actually gets impaired. So you're not getting the innervation from the vagus nerve to the different organs that it's supposed to innervate. So the vagus nerve runs, it's basically the longest nerve in the body, runs from the head down through your neck, which is where we can inject, and then down and ends up around your diaphragm. So that controls your liver, your stomach, your intestines, even your kidneys and bladder. So it's very important for basically your lower half of the body. So those who have, digestive issues or bloating or urinary issues, typically the vagus nerve is not firing as it should because they're just not getting the right innervation. So typically going back is like when someone who's more in the fight or flight dominant side, the rest and digest just gets imbalanced. So then you're not firing as the way you should be. So this is where when we do the injections, it's like getting the yin and yang balance. So if we inject the stellate, we also want to inject the vagus nerve because that's basically restoring order to that nerve that's then firing properly.
So from what I'm hearing, please correct me if I'm wrong.
Sure.
It probably would be more optimal to do both. Is a patient able to do both to kind of get both sides?
Yeah, we typically do both in the same
nervous
visit.
Systems? Okay, perfect. Yeah. I'm thinking about this therapy for my husband who absolutely hates needles. Nonetheless, a needle to the neck. Are there other ways of administering this type of therapy?
Sure. Yeah, the next best thing is then an IV infusion of Procain. So you can actually get it into your blood vessels, which does have a very similar calming effect. It's not as direct, localized to the nerves themselves, but just generally having Procain in the system does get it to the brain, which quiets down the noise a little bit. So it can be a nice option. In comparison to the injections versus the IVs, typically you'll need less injections to achieve, I would say Zen or relaxation versus the IVs. You might need to do a little bit more often initially. The good thing about them is they're both cumulative though. So if you do them often enough, you do get to the threshold where the nervous system has kind of reset for the time being. Okay.
And a patient coming in for a treatment plan for one of their various chronic symptoms, what would a typical protocol look like? Is that once a week, once a month for this therapy?
Yeah, depending on what they come in for. If it's like really chronic illnesses, this could be like autoimmune, mystery infections, even cancer. We could do the neural therapy as a starting point just to reset the nervous system. Because once the nervous system is reset, the innervation to the organs is more beneficial. Like it's more effective for anything else you're going to do, whether you're giving IV vitamins or oral supplementation. If the nervous system is balanced, it can intake the nutrients better and expend energy more efficiently.
I see. So you mentioned something that was interesting because I know in the integrative medicine space, not all therapies are good for cancer patients. And you'd mentioned that this might be a therapy that a cancer patient can actually have. Is that correct?
Yeah, that's correct. Yeah.
Okay. So just thinking of some loved ones that I know that are dealing with cancer, how could the neurotherapy treatment benefit somebody like that has cancer?
For the first part is just the emotional stressors from having the cancer diagnosis. So that could be very traumatizing for the individual. So just simply getting a little bit of Procaine, either an IV, will help just to calm their mood down. So that's a very good start. And in terms of, energy, if the nervous system is balanced, their energy does increase, which, oftentimes cancer patients, they have a little more fatigue than usual. But for me, like we look into the root causes of what may have driven cancer in that, in that situation. So usually there are emotional triggers or stressors. There's sometimes pathogens or toxins. So if it's from a pathogenic standpoint, the neurotherapy does help the immune system to restore order so that you're passively able to fight infections a little bit better. From the toxin standpoint, if there's a lower load of toxins that interferes with the cellular, metabolism, causing oxidative stress, inflammation, and then that can lead to different cascades of, cancer involvement. So the treatments for the neurotherapy improve detoxification function because you're restoring the nerve flow to those organs that are supposed to help you detox, like your liver and your kidneys and your colon. So you're just kind of restoring order back to the way the body is meant to.
I'm not really hearing any downside.
There really isn't, yeah.
Like, can I come there today?
Yeah.
is there medical research or supporting evidence that this therapy works? Are there clinical trials, studies?
There's probably thousands. If you just do a PubMed search or different searches, there's thousands of articles. The more recent one, I think, was in 2023 in a more prestigious journal, like Journal of Clinical Medicine. That was a summary of like 129 different, higher level research that was done on neurotherapy. And then they, particularly in that article, they took away the term neurotherapy just so that they wouldn't get prejudiced against, being as an alternative therapy. But it was basically the topic, the title was the use of low dose anesthesia in the treatment of chronic pain and other illnesses. And so it was very positive in terms of the research that it shows that it does help with multiple conditions. And there's also textbook manuals that are being produced on the neurotherapy. Unfortunately, in the U.S., it's a little slow in the realm of adaptation.
It's still gray area.
Yeah, but in Europe and actually South America, like heads of hospitals are actually utilizing and they're participating in the actual research for neurotherapy. So if you go into major hospital institutions in South America, you're likely to be able to get a neurotherapy.
Amazing.
Yeah.
So another question that comes to mind as we're talking is how neurotherapy, because of that emotional release too, that really helps restore the body's order and homeostasis, how somebody who might be going through therapy for a death or, life trauma or whatever challenge they're dealing with, how this type of therapy, I would imagine, could speed up.
Oh, definitely. Yeah.
Could speed up any type of psychological therapy or behavioral therapy that you're going through.
Right. So I could tell you two case examples of the situation. So one patient, she had lost her husband and she was dealing with a mold, issue in the property that probably led to the death of the husband, as well as her own illness in relationship to mold. So we had treated her with the neurotherapy just once initially. The second time we did just to enhance the effects further, but the treatment afterwards, her energy level skyrocketed because she was able to process now the grief that occurred. It didn't take away, the feelings, but it just allowed the body to be more energy efficient right after the treatment. So she was able to get things done. Sometimes you're stuck in a funk. You can't do anything after something like that.
Because your body's holding that negativity.
So it's holding that issue. And so for her, it was a very dramatic difference right after the treatment. So she was able to get a good night's sleep and then start to have more energy for doing the rest of the things she was meant to be doing, afterwards. The other patient, he had his wife cheat on him and was filing for a divorce right around the time that we got started treatment. Well, yeah, his stress levels, if you can rate it, he told me it was like 11 out of 10. And then after the treatment, it dropped to 0 out of 10.
Are you serious?
For the next day, and then it lingered and still maintained around 1 or 2, since we've been seeing him. And this has already been a few weeks since that.
Are you serious?
Yeah. So it was, give him a new lease on life, not to worry about, things that you can't control.
Wild. That's wild.
Yeah.
I definitely need to try this out. In terms of longevity, I know we talked a little bit about that. How can neurotherapy be used to maintain longevity, good health as we age?
Well, the interesting thing about Procain is there is a commercial product that was created, I forget, either in Europe, called Gero Vital, which is still available if you look for it, but it's just Procain.
Is it?
Yeah.
So and it's over the counter?
I think you can buy it online, different sites. I mean, it's not as regulated here, so you might be able to find it online, but it's coined as a, longevity or anti-aging tool, but it's just technically a Procain that you can actually either ingest or get in as a treatment. So the effects of Procain go beyond just resetting the nerves. So there's other benefits on improving vasodilation. And so you actually get improved blood flow when you get, either IV or injection of Procain. So if you add into longevity, you have better blood flow to your organs. They're going to have better communication as well too. So in the longevity standpoint, it's just making sure that things are running, for a long period of time.
the car is running, it's well maintained.
So you're able to clear out the trash, you're able to get nutrients into the organs so that they're well fed and getting oxygen to the brain. Yeah. So that's the benefits of having, Procain or other agents, but Procain is as a single tool is very, very powerful for that.
Amazing. Yeah. So one last question I have is, what drew you to this therapy? I mean, as little as I know about it, it's very interesting, and I definitely see all the benefits with very minimal risks.
Yeah.
How did you get into this space? How did you learn about the therapy?
So I got into it as more of just adding tools to my tool belt for treating patients. So I was already doing a lot of regenerative injections. So these are more for like joints and connective tissue disorders and injuries. And then there's another side of it where patients maybe don't always get better from those injections alone. And then also mental emotional issues are really rather challenging for you to treat, even in a functional medicine standpoint. So you can get the right nutrients in, but if their mindset's sometimes stuck a certain way, or they've just gone through certain levels of trauma that they can't resolve, it takes a lot of work to address those things.
Yes.
So I looked into neurotherapy as a treatment modality that can address a lot of these other background things very, very rapidly. So having the access to Procain, which we had been using prior to for the regenerative side of things, but just adding it in a different mechanism or a different administration makes a huge difference on a person's one mental state, then transcends into the physical body afterwards too.
Well, actually, what I loved about what you said, and just thinking about again my husband who's always very high stress, his life is very high stress because of work.
Yeah.
And I know a lot of people that are like that really just can't stop.
Right.
They have been going 100 miles an hour, cannot stop themselves. And this is almost like a forced reset. It's a shutdown. And the fact that this therapy can do that for the body is amazing.
It is, yeah.
And life-changing, if anything.
Right.
I don't have any other questions. Oh, I do actually. Is this FDA approved? Is this therapy FDA approved?
The therapy itself, so FDA doesn't govern the actual therapies as much. They do govern the medicine. So Procain is FDA approved. Yes. A lot of the anesthesia is FDA approved. So as far as the treatment goes, you can't really say it's FDA approved because it's not you're not using medical devices or anything. So that's what the FDA governs is. So as far as the medication goes, yes, it's FDA approved. The treatment therapy is just more, an individualized therapy that's out there.
Okay. Yeah. So is there anything else you wanted to add?
Yes, I'll add a couple of things. So you can, with neural therapy, the Procain is what we talked about as the primary agent that can be used. There's other things that we can stack in to enhance the effects even further.
Okay.
So this is where you can utilize ozone, for example, in certain cases, depending on the scar that's involved. So you have a stronger change in that physical space. And ozone actually can be used to remodel the scar tissue more quickly than the Procain would do on its own.
But how would you administer the ozone with the Procain?
So typically I have two separate syringes. So one with the Procain and then one with the ozone. So when I thread the needle through, I'll just twist off the Procain syringe and inject the ozone separately. And then basically without injecting you again, just leave the needle in place and then we inject as we go through.
Now, what are you noticing by adding ozone to the neurotherapy?
So for more of the structural scars, they look prettier faster.
Oh, I see.
For more of the aesthetic standpoint, and then the tissue changes are more noticeable. Because for one, you're actually introducing oxygen to that area. It's reactive oxygen, but it's still oxygen. And so you're getting better blood flow from the Procain and also better nerve conductivity, and you're just flooding with oxygen. So it just heals much more rapidly. So for keloids, this is actually the way to go versus just Procain alone.
I see.
Yeah.
Okay.
And then there's the use of using exosomes, which I don't know if your patient population are very aware of, but this is where it gets into a whole different level of healing. So besides just putting Procain into when we do some of the autonomic ganglia, we can also inject some exosomes along with it as well too.
Really?
Yeah, because the exosomes then allow for actual regeneration of the tissues, and they travel along the nerves to get to the brain. So you actually get extra exosomes to the brain function. So it's really neat stuff. Yeah.
Now, if somebody like my husband comes in and does not want the injection in the neck, can he have the exosomes administered via IV with the Procain via IV?
Yeah, you can do that as well.
It's not as potent,
not as potent, but yes,
it's still efficacious.
Yeah, still efficacious. Yeah.
Okay.
Yeah.
Wow, that's amazing.
A lot of neat stuff. Yeah, there's a lot. Yeah.
I've learned a lot today. And I think there's a lot more. I'm going to have a lot more questions for sure.
Yeah.
But for now, that's all I have.
Okay.
Thank you so much, doctor, for being with me.
Yeah, you're welcome. I'm happy to be here.
And I'm going to come visit you.
Okay, awesome. Welcome.
This podcast is sponsored and brought to you by One Body Medicine. You can learn more by visiting onebodymedicine.com. That's the number 1, bodymedicine.com. You can also follow the show on social media under the handle Pure Wellness Pod. Thank you for listening, and we'll see you next time.